Okay, so nervous system, spinal cord and spinal nerves. We mentioned in the first lecture about the fact that your central nervous system is exclusively going to be your brain and your spinal cord because it's dead center in the middle. And anything coming off of that is going to be peripheral or side, right? Like your peripheral vision. So we're going to talk about now the spinal cord, which is going to be central nervous system, and the spinal nerves, which are going to be branching off of that. So here is, of course, the brain and the spinal cord. Brain up here, spinal cord coming off of here. So I think that there is a fallacy or a misbelief that the brain and the spinal cord are completely separate from each other, but that actually isn't true. The brain stem actually connects to the spinal cord, and externally, you cannot tell where one begins and the other ends. Internally, if you slice like a ham in the brainstem until you hit that butterfly, once you hit the butterfly, it is then considered spinal cord. But externally, like I said, there's not really much difference there. Okay, so the spinal cord actually only extends to about L2, about lumbar vertebra 2. Beyond that is something that we call the filum terminale. As you come down, you'll notice that it expands a little here. This is actually called the cervical enlargement. So cervical, think about the neck vertebra, the cervical vertebra. This is actually where the nerves for your arms are going to be coming out. So technically, having a little bit more matter or material there does make sense. It thins down again until we get to about here. And you can see that it does expand quite a bit. This is called the lumbosacral enlargement. So the lumbar and the sacrum, right? But that lumbosacral enlargement is where your legs are going to be. So all of those nerves that are going into and coming from your legs, there's again a reason that there's more matter, there's more material in that area. You can see that we've got kind of this tapering here, and it develops into this cone that's dead center in the middle. So it's called the conus medullaris. Yes, the middle cone. Now, coming off of that, remember I said your spinal cord ends about L2, which is actually pretty high. You have all of these roots coming off of it. See that? Almost looks like a ponytail, right? So they call this the cauda equina. Equina means horse. Cauda is tail. So they call this the horse's tail or the cauda equina. That is the name for that structure. Each one of these yellow things that you are seeing here is going to be a spinal nerve. They come off of the spinal cord and they come out through the vertebra, okay? The roots of the spinal nerve are going to be what we just saw in that picture of the spinal cord. So we're going to go through that again, but just so you know. So, looking closely, our spinal cord does not just sit within the bone. If it did, the bone would damage the spinal cord, which isn't a good thing. So we have these layers of connective tissue that actually protect our spinal cord called the meninges. Okay, so these are the meninges of the spinal cord. There are 3 layers to the meninges. The outermost, or the toughest, is called the dura mater. Literally translated, that means tough mother. Okay, it's the thickest, it is kind of the most rough and tumble, and it is the outermost. Internal to that, you have what we call the arachnoid mater. Now, think about arachnoid. What does it sound like? Arachnid or spider. So the arachnoid mater, the spider mother, if you will, is actually called that because the way that it almost looks like cobwebs. It's very thin and it's very wispy. So that inner layer is, or the second layer, I should say, is going to be the arachnoid mata. Now, between the dura mata and the arachnoid mata, there is a space here. This is called the subdural space. Okay, sub, below, dura, below the dura, space. Okay. Then we have one more layer internal to that that's almost like shrink wrap right on top of the spinal cord. That layer is called the pia mata. Pia means affectionate. And the reason that they use pia mata is because it's almost like it hugs the spinal cord. It's right on top of it, almost like shrink wrap. Now, again, there is a space between the arachnoid mata and the pia mata. You can see it right here. That is the subarachnoid space. Sub, below, arachnoid, the arachnoid mata space. Okay? So, our spinal cord cannot just bang around inside of a vertebra. If it did that, it would get damaged pretty quickly, especially since it's made out of nerves. So how do we keep it in place? Well, one thing that we have these ligaments that hold on from the sides. So all the way around. Those are called denticulate ligaments. Dentitions are teeth. So you can see one here, you can see one here, and they go from the pia mata to the arachnoid mata to the dura mata to hold on to prevent shifting laterally, okay? So the other way that we kind of have to hold our spinal cord in place is up and down, from superior to inferior. So think about somebody, let's say on a skateboard, and they're on their belly rolling, and I grab their feet and I go, real hard. If I do that, that stationary force would cause their spinal cord to basically jut up into their brain, which wouldn't be a good thing. So how do we prevent that? So everybody's probably seen a video either online or on America's Funniest Home Videos where somebody puts pantyhose on their head and then somebody tries to yank it off, but instead of actually coming off and slipping off, it holds and it gets tighter and tighter until they're basically doing this with their head while they yank on those pantyhose. There's something kind of similar to that called the filum terminale that basically is around the entire spinal cord and it anchors down to the coccyx. So I'm going to go back a second. See this thing right here? This is the filum terminale, and that actually is kind of like those pantyhose. So when it gets yanked on really, really quickly, it tightens and it holds it in place. Okay, so we've seen this in our spinal cord model, but you can see that root coming out of my spinal cord. There's my ventral root. My posterior root is kind of buried back there, but you can see the dorsal root ganglion, that little swollen portion right there. And then where they merge together is that spinal nerve, okay? And this surrounding material, that's the epineurium, just like what we saw in the nerve cross-section. So here is the spinal cord inside of the actual vertebra. Here's my spinous process facing the back. Here's the body. So here's my gray butterfly, right, with my gray horns. Here's my white matter or my white columns. Again, you can kind of see that I've got that continuous white matter in the front, and these are almost extending all the way to the back here. So here is my dorsal root coming to my dorsal root ganglion. Here's my ventral root. There's that spinal nerve where they merge together. Here is my dura mata. Notice that between the dura mater and the bone of our vertebra, there's a fat pad here. Okay? That is the epidural space. Anybody who's ever had a kid or who has had a significant other who's had a kid, women who are in labor get epidurals, right? They're actually coming in this space here to deliver that medication. Now, if you've ever had to sign a waiver so you can get an epidural, you know that they do the whole, it can cause nerve damage, it can cause paralysis, well, look at how little this space is that they have to get that needle into. Now, keep in mind, in this picture, this is probably about 25 times bigger than what they're aiming at. Yours is very, very tiny compared to that. But that epidural space is filled with fat. Remember I said, I don't want my spinal cord rattling around in between the bones. Putting pillows around it actually helps to protect it and helps to pad it. So we've got our dura mater kind of in a pink. Then we've got the subdural space, that black line. Then we've got the arachnoid mater. I've got the subarachnoid space, and then we've got the pia mater, which is literally right around the spinal cord. Like I said, it's like shrink wrap. You can also see the denticulate ligaments. Remember I said it's from the side, so it holds it so that it can't shift one way or another too much. Okay. Yep, that's everything off of that. Here is the picture that we just went through for our histology. You still have that gray butterfly in the middle. You've got the posterior gray horn, the anterior gray horn, the lateral gray horn, the gray commissure in the middle, that central canal. Again, remember, this is just one slice out of your spinal cord. Your spinal cord is long, so that little hole there is actually going down that entire length of your spinal cord. You've got the white matter on the outside with the posterior white column, the lateral white columns, the anterior white columns, and then that white commissure that connects the two sides of the white matter, the gray commissure that connects the two butterflies. You have the anterior rootlets, the anterior root, the posterior rootlets, the posterior root ganglion. Remember, dorsal and posterior are interchangeable. I use posterior because it's what I'm comfortable with. Anterior and ventral are also interchangeable, but it's what I'm comfortable with, so I always use anterior. And then where they merge is going to be the spinal nerve. You've got that fold, dead center in the middle in the front. So it's the anterior median fissure. So anterior front, median in the middle fissure crack. In the back, you have the posterior median sulcus. So back, middle fold or groove, which is there. So yeah, you've got all your parts and pieces, same as what we discussed in the previous lecture. Well, actually, lecture number 2 for the neuron. So here is one spinal cord model. You'll notice that, like I said, the butterfly cuts off this white matter when it's in the back, and the white matter is continuous when it's in the front, okay? So we've got the posterior white column, the anterior white column, the two lateral white columns, the white commissure, which is that little piece of white matter here. We've got the gray horn, posterior gray horn, the lateral gray horn, the anterior gray horn, the gray commissure connecting the two wings, and that central canal. In the front here, we've got that anterior median fissure. In the back here, we've got that posterior median sulcus. Looking at the model, see all of these individual little teeny tiny roots? Those would be the rootlets. So we've got the anterior rootlets, we've got the posterior rootlets. Now notice, they come together to form one cord. So you've got the anterior root, and you've got, can't see that, the anterior root where they all come together, the posterior root where they all come together. Then you've got this bulge here. That's the posterior root ganglia. And where they merge is going to be the spinal root. Okay? So posterior median sulcus, anterior median fissure, there's the gray commissure, there's that central canal. So looking at the nerve, again, a nerve is not a neuron. A lot of people make that mistake. A nerve is a whole bunch of neurons. If this is one axon from one neuron, you can see that we've got bundles and bundles of them. So each individual neuron is surrounded by an endoneurium, a connective tissue endoneurium. Then we bundle those together with a perineurium. And each one of these bundles, or bundles of axons, is called a fasciculus. If you want multiple, it would be 4 fasciculi in this picture. And then you've got this loose connective tissue with arteries and veins and adipose tissue just kind of filling out that space, surrounded by an epineurium, another piece of connective tissue. I talked about this before, but if you think of an electrical cord, most electrical cords are not just one big, huge piece of metal inside of rubber. You actually have different fibers that you are housing together and kind of separating and then putting them together, bundling them together with another ginormous piece of rubber. So that's a nerve. Wait a minute. That's the spinal nerve that I'm talking about. This is a collection of neurons. So when we look at our spinal cord, these roots coming off of them are spinal nerves. And we have different numbers of spinal nerves. Cervical, we have 8. 1, 2, 3, 4, 5, 6, 7, 8. Thoracic, we have 12. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. If you can count, you'll be able to figure this out. Lumbar, we have 5. 1, 2, 3, 4, 5. Now remember something. Our spinal cord at the conus medullaris ends, right? But the cauda equina extensions or roots are actually extending further than that. So if it's ending up here around L2, we still have L4, 5, 3. We even have the sacral region where we've got S1, 2, 3, 4, 5, and even C0 in the coccyx. Those are all coming off of those roots that are extending from the cauda equina. Now, we do not name the nerves based on where they're emerging inside of the vertebra. We name them based off of where they're emerging outside of the vertebra. So when we name them based on where their position is near the vertebra, that's why, because their position is at the sacral vertebra. Their position is at the thoracic vertebra. Even though they may be coming off the spinal cord higher than that or lower than that, it doesn't matter. So, if you can remember breakfast, lunch, dinner, you can remember numbers. So if I were a normal person who, worked a 9-to-5 job, then I might have breakfast at 8 o'clock in the morning. There are 8 cervical vertebrae. If I were a normal person who always had lunch at the same time every day, it would be at noon, right? There are 12 thoracic. And again, if I were a normal person and had dinner every day at the same time, it might be 5 o'clock. There are 5 lumbar and 5 sacral nerves, as well as 1 coccygeal. And the one coccygeal is called C naught. C with a 0. Okay? Why? Because I don't want to get it confused with C1, 2, 3, 4, 5, 6, 7, and 8 up here. Okay? So C naught is just that one nerve down here. So thoracic is T1, 2, 3, 4, 5, T1, T2, T3. Again, if you can count to 12, all you have to be able to do is count. That's it. You know that there are 8 cervical. So 1, 2, 3, 4, 5, 6, 7, 8. And then there are 12 thoracic. 1, 2, 3, 4. And all you have to do is put T1, T2, L1, S1. It doesn't matter. I'm not going to make you write out thoracic. I'm not going to make you write out cervical. C1, T1, L1, S1, C naught. That's perfectly fine with me. Okay, so I'm going to stop there and go to the next one.